Hi guys, welcome to my channel. It's Toya with All About Nursing. We're going to continue this drug dosage calculations today. Today we're going to be doing weight-based drug dosage calculations. We did a little bit of it previously, but we're going to be doing episode 5 question scenarios where we'll be working out the maths of these drug dosages. So let's do this. Our first scenario is, we have a patient that weighs 15 kilograms and is prescribed a medication at a dose of 10 milligrams for every kilogram per day. How much medication should this patient receive per day? Okay? So now we're going to have to say how the patient is weighing 15 kilograms. So our patient's weight is 15 kilograms. Alright? Our order is 10 milligrams for every kilogram per day. Alright? So we know we need to find out how much medication this patient has to get in a day. Alright? So we need to take the weight of the patient and you multiply it by the amount, because it's 10 milligrams for every kg this patient is weighing. So we're going to take 10 and you multiply it by 15, and it's going to be 150 milligrams in a day. So how easy that is? 150 milligrams in one day. Alright? So that's scenario 1. Scenario 2. A patient weighing 70 kgs is prescribed a drug at a dose of 2 milligrams for every kilogram every 8 hours. How much of this drug should be administered per dose? Okay? So our patient is weighing, our patient's weight here is 70 kilograms. And the order is 2 milligrams for every kg that our patient weighs. Alright? So now we know what we have to do. How much does our patient weigh? 70 kilograms. So we're going to multiply that, because the order is we are giving them, for every kilogram that they weigh, we are giving them 2 milligrams. So it's going to be 2 multiplied by 70, and that is going to be 140 milligrams this patient is going to get in a day. A medication is prescribed at 5 milligrams per kg per day for a patient who weighs 50 kgs. The medication needs to be divided into 2 doses. How much medication should be administered per dose? Alright, so what we have, our order is for 5 milligram per kg per day. Right? Our patient weighs 50 kg. And we want to find out when we divide it by 2, because it's going to be 2 times they get in it for the day, okay? So we want to find out how much is going to be that they get in every dose, okay? So what do? 50 kgs multiplied by the 5, because it means we're giving them 5 milligrams for every 1 kg. So we go in 50 multiplied by 5 equals to 250 milligrams per day. And we want to find out for a dose, because the dose is BD. The dose is twice daily. So we have to divide this by 2. And we will get 125 milligrams per dose. So this patient is getting 125 milligrams every dose. Okay? So the patient's weight was 50 kgs. The order was to give the patient 50 milligrams per kg per day. We wanted to know how much was the 1 dose a day, because the patient gets 2 doses. So we need to find out how much they were getting in a total for the day, which was 50 kgs multiplied by 5, which will give you 250 milligrams. And you get to divide that by 2, and you will find out how much the patient was getting for 1 dose. because they were getting 2 doses to add up to equal to the day. All right. So we have a patient that weighs 80 kgs and is prescribed a medication that requires a loading dose of 15 milligrams per kg. So what is our patient's weight? Our patient's weight is 80 kgs. What is the dosage we have? 15 milligrams per kg. So we want to know how much is the dose this patient has to get. So it means that every kg this patient weighs, they have to get 15 milligrams. So we did it already before, so we'll do it again. So we're going to multiply 15 milligram by the amount of kgs the patient weighs, and that will be 1200 milligrams is the patient's loading dose, because 15 multiplied by 80 is giving us 1200, and that is the loading dose our patient has to get for that order of getting 15 milligrams per kg and weighing 80 kgs. See, it looks complicated when you see the order. You get scared and you feel like, oh my gosh, how am I going to calculate this? You just have to keep practicing. You just have to remember your units of conversion and you'll be able to get it. Okay? Last but not least, number 5. An antibiotic is prescribed at a dose of 30 milligrams per kg per day for a patient who weighs 25 kgs. The total dose needs to be divided into 3 equal doses. How much medication should be given per dose? Okay? Alright. So our patient's weight is 25 kgs and our ordered medication is 30 milligram per kg for the day. Our dose is 3 times daily, or TID as we say. Okay? And what is the dose? X is equal to dose. Alright? So let's be this. So what do? We take our patient's weight and you multiply. Why? Because it says here we are giving this patient 30 milligrams for every kilogram that they weigh. Here our patient is 25 kilograms. So we're going to do 30 milligrams multiplied by the 25 kgs, which will give us 750 milligrams in a day. That is our day. We want to know how much for 1 dose because the patient is getting 3 times to add to this. What do? You take your total for the day and you divide it by 3, which will give you 250 milligrams for every dose. This patient is receiving 3 times a day, 250 milligrams, which will add up to 750 milligrams for the day. So our order was 30 milligrams for every kg per day. Our patient's weight was 25 kgs. We wanted to know, because this patient gets this medication 3 times a day, how much am I giving this patient for 1 time for the day? So we have to break it down. How much am I giving the patient for the entire day? You multiply the dose by your patient's weight, which is 750, and I divide it by 3 because I'm giving it 3 times a day, and that means I'm giving my patient 250 milligrams 3 times a day. I hope that weight-based calculations wasn't too intimidating for you. I hope that you were able to understand the maths and be able to practice it yourselves. Please practice your medication administration, drug dosage calculations, please. It is very important to be safe practicing nurses. So we have to ensure that we have our patients getting safe care. Look out for our next video. Don't forget to like, subscribe, and share, and comment down below.